As if the Trump administration hasn't spent enough of your taxpayer dollars on the Iran war, there are reports now that Republicans are considering cutting your healthcare even more than they already have to pay for the Pentagon's $200 billion request for additional funding.
There are reports that Republicans are weighing cuts to healthcare in order to make way for that $200 billion for the Pentagon and Operation Epic Fury. Is that a trade-off that President Trump supports?
I've seen these reports. I haven't spoken to the president about it, nor have I heard this being discussed in any high-level meetings here at the White House. I don't want to weigh in definitively because I just haven't heard that being discussed here in the West Wing.
First of all, Karoline Leavitt is a liar, and I don't believe anything she says, but the tell is always in what she doesn't say. She says she can't weigh in definitively on this question because she hasn't heard anything about it. But she could always just say no, right? She can say that no, Trump will not cut your healthcare no matter what to fund this war. But there's a reason she doesn't say that. And the reason is Trump has already cut $1 trillion in Medicaid, proving he does not care about you or your healthcare. And that's the reason Karoline can't say no to this question, because he has already cut your healthcare once. She can't say that he won't do it again.
We can't take care of daycare. We're a big country. We have 50 states. We have all these other people. We're fighting wars. We can't take care of daycare. You got to let a state take care of daycare, and they should pay for it, too. They should pay. They have to raise their taxes, but they should pay for it. And we could lower our taxes a little bit to them to make up, but it's not possible for us to take care of daycare. Medicaid, Medicare, all these individual things, they can do it on a state basis. You can't do it on a federal. We have to take care of one thing, military protection.
I mean, that's the truth of Republican priorities, laid out very clear for you. Trump has said exactly what his priorities are, and you are not one of them. We're fighting wars, he says, so we can't take care of any of the things that might actually make your life better. Things like daycare, or Medicaid, or Medicare, or food assistance, or veterans benefits. None of that falls under his purview. All he thinks the federal government should focus on are foreign wars that do absolutely nothing to actually improve your life. Apparently, for the richest country in the world, taking care of its own people isn't possible. But $200 billion for a war? Yeah, that we can definitely do.
We have a war on a nuclear Iran that could be paid for by the president's war on fraud. And as you said, there's a boatload of fraud across the federal government. We just addressed Medicaid and SNAP, but there are 70 plus means-tested welfare programs across this entire people's government, and about $1.5 trillion cost. You mentioned the GAO reports. This just makes too much sense.
Oh, so we're not cutting healthcare, we're cutting fraud. Okay, this is the Fox News propaganda machine in action. They can't say we're taking healthcare and food assistance away from you in order to bomb Iran, even though that's what's actually happening. So instead, they'll say we're battling fraud. So you don't realize what's actually happening, which is that they are cutting funding for you and your family's healthcare in order to increase funding for a war that no one asked for, no one wanted, and Trump can't even tell you when it'll end. Just so we're clear on who we're talking about, right now about 71 million Americans are on Medicaid. That's almost 1 in 4 Americans. And 41% of US children are on Medicaid. Those are kids we're talking about. Where exactly is the fraud in making sure parents can afford to take their children to the doctor? And we know exactly what they're thinking about cutting, because even though Karoline Leavitt claims she hasn't heard anything about this, Axios reports that House Republicans are looking at changes to ACA cost-sharing payments, which sounds technical until you read about what that actually means, which is that 300,000 more Americans could be uninsured, thousands more, many other enrollees could see more out-of-pocket costs and higher premiums. Healthcare is already unbelievably expensive. I mean, I don't have to tell you how much more can they possibly expect you to pay. The war on fraud is actually just a war on you. They are cutting your benefits so they can fund bombs abroad.
Every dollar we are spending bombing people in the Middle East is a dollar that we are not spending in our communities in this country. And Tim, we're always told that there's not enough money for schools, not enough money for healthcare, not enough money for veterans, but there always seems to be enough money to bomb people on the other side of the world. And so I think it is possible to support the democracy movement in Iran. It is possible to stop Iran from getting a nuclear weapon without this kind of reckless military intervention.
This is the thing that you never hear on Fox News. This is a deliberate choice Republicans are making. Every single dollar that goes to the Pentagon to fund wars abroad is a dollar that doesn't go to your kid's school or your mom's Medicaid, or your VA benefits, or countless other things that would actually make your life better. And we've all been trained to just accept this kind of scarcity. I mean, the Trump administration tells us that there's not enough money for the teacher shortage, or to lower childcare costs, or to lower the cost of insulin, or your prescription drugs, or to actually take care of the veterans we sent to the last war. But then suddenly there's $1 billion a day for the Iran war? Turns out the account isn't empty after all. The money has always existed. Trump and his administration decided that you aren't worth it.
If you live in a rural community, you're gonna be hurt too. In New York 23, 25% of people are on Medicaid in this area of upstate New York. Westfield Memorial Hospital will be at risk of closure. UPMC Chautauqua is at risk of closure. Schuyler Hospital at risk of closure. California 23, where 46% of people are on Medicaid. Redlands Community Hospital at risk of closure if this passes. Victor Valley Global Medical Center, Loma Linda University Medical Center, all at risk of closure. Colorado 8, 24% of people in this community are on Medicaid, and Platte Valley Medical Center will be at risk of closure.
446 hospitals are at risk of closing or cutting services because of Medicaid cuts that have already been passed into law. And now they're considering doing even more. There is at least one at-risk hospital in 44 states. This affects literally everybody. And I want to talk specifically about how this affects rural communities, because during campaign time, Republicans love to perform concern for rural America. The budget bill Republicans previously passed set aside $50 billion to support rural communities, which sounds like a lot until you find out that in that same bill, Medicaid funding is projected to be cut by $137 billion. So they gave rural hospitals $50 billion with one hand, and then with the other hand, took away $137 billion. And they're just hoping you don't notice. These aren't just abstract budget lines. These are actual lives we're talking about.
I have my insurance. I literally I'm going to die this year. That's the brass tacks, unfortunately. I won't be able to afford my medication. I won't be able to afford my treatment.
Over 20 million Americans are facing huge increases to their health insurance, including Joanna, who was diagnosed with cancer last year. She says she can't afford her care without insurance.
You already know that these are real lives that we're talking about. I don't need to tell you that cutting healthcare funding costs actual lives. And the thing is, Trump and Republicans know it too, but the difference is that they do not care, straight up.
Today they hit $4.
We're $4, yeah, and we have a country that's not going to be throwing a nuclear weapon at us in 6 months.
But Americans are feeling the effects in the interim.
And they're also feeling a lot safer.
Because this does not affect them. Trump is not worried about his immunotherapy bills. Republicans in Congress don't have to ration their medication. Trump's administration isn't lying awake at night wondering if insurance will cover their doctor's appointment next week. They have the best healthcare in the world, funded by your taxpayer dollars, and you know damn sure that that's not what they're going to be cutting. They're going to cut your healthcare instead. 20 million Americans are looking at massive increases to their health insurance costs right now. And that's before the further cuts that Republicans are now talking about. There is $1 billion a day on the table for this war, and possibly another $200 billion to the Pentagon. There is not apparently enough money for Joanna's immunotherapy, or your insulin, or your healthcare, or your food assistance, or anything else that might actually help you.
I think that if there are people in Iran who now, given everything that's happened, are willing to move in a different direction for their country, that would be great. Imagine in Iran that instead of spending their wealth, billions of dollars supporting terrorists or weapons, had spent that money helping the people of Iran, you'd have a much different country.
Marco, you are literally in the middle of asking Congress to spend $200 billion for weapons. You are part of the administration that just cut $1 trillion from Medicaid. You are defending a war that is being financed by taking healthcare away from cancer patients and closing maternity wards in rural Georgia. And you are standing there with a straight face criticizing Iran for spending money on weapons instead of its own people. The Trump administration will always find the money for war. They will never find the money for you. They have decided that $200 billion for war is non-negotiable. But your healthcare is negotiable. You are the line item that gives way when the math gets hard. And they are counting on the process being complicated enough, the legislative language obscure enough, the news cycle fast enough, that by the time you'll feel these consequences, they'll have moved on to the next thing. There is not a flicker of self-awareness across all of these clips. No pause, no acknowledgement that they are cutting healthcare for millions of Americans in the same breath that they're condemning Iran for not taking care of its people. They are completely unbothered by the contradiction, because to be bothered, you would actually have to care about Americans and the people being hurt. And they have made it abundantly clear through every vote and every budget and every non-answer on national news that they do not care about you.